All right, now we're going to talk about sodium, and it's interesting the effects that sodium has because previously we've been talking about all the effects that the electrolytes have on the membrane and the action potentials, and sodium has been a main character there, and so it would make sense to assume that if you have too much or too little sodium, that would have a huge effect on the action potentials and the membrane depolarization or repolarization. But in reality, when you see high or low levels of sodium, typically what that actually correlates with is a volemic issue. Because sodium is heavily involved in the where fluid goes and the retention of fluid and the way that the kidneys hang on to or eliminate fluid, hypo and hypernatremia are typically more of a symptom of a fluid problem. And the effects of high or low sodium on the individual membranes are actually kind of um, negligible compared to the issues that having too little or too much fluid cause. So, first off, we're just going to talk about the volemic issues and kind of put sodium on a side burner for a minute. So, the symptoms of many of the different types of hyper and hyponatremia are really only associated with what that means for the fluid volume in the body. So on this side, if you have hypovolemia, then you're in the sodium is doing what it's doing, but you're in a state where there's just not enough fluid in the body, and sodium is representative of that, but the symptoms are related more to the volume problem than the sodium problem. So when your volume goes down, well, what does this do? It means that your heart has less fluid to push. And less fluid to push means that there is less pushback on that fluid. And so the blood pressure starts dropping. You have to maintain your blood pressure. And when there's not as much fluid to move, there's not as much fluid to push back and cause afterload. And so um, it also causes reduced preload. So basically, on both ends of the spectrum, your cardiac output decreases, your blood pressure drops. Um, so you get decreased blood pressure, and especially you get orthostatic hypotension because that reduced preload means that when you stand up, your body doesn't have as much fluid to push back up to the heart, and so when you change positions, you especially get orthostatic hypotension, but you also just kind of get general hypertension too. The way that your body tries to compensate for this is the baroreceptors in your body say, oh, damn, we don't have enough booze. We start getting a little panicky, um, getting a little worried that the drinks are running out. And so it starts bumping the heart rate up to try to compensate for it. So preload goes down, but the heart rate goes up to try to make up for that. And so the total effect can be mostly that the blood pressure, in severe cases, you can get general low blood pressure, but typically what happens is that the increased heart rate compensates for the decreased volume. And so you kind of get, unless it gets really bad, you get normal BP, but you still have the orthostatic low BP. Okay. And then as symptoms progress, then you can just get low blood pressure because at some point the heart just can't beat any faster and the compensation runs out. Hypovolemia can cause perfusion issues. A lot of times, hypovolemia is only indicative of fluids that are missing from the vasculature, but the body still has a lot of fluid in it. So this is often, it doesn't necessarily cause, but it is often associated with third spacing or edema. Like I said, it doesn't cause this to happen, but this causes this to happen. You start losing fluid into the third space. You start losing fluid, like in the peripheral areas, and you end up with too little fluid in the vasculature. And so most of your symptoms related to that, the most important ones, are basically just related to the fact that you don't have enough fluid. Your body starts, the baroreceptors and your body starts kicking out ADH. It'll make you really thirsty because pretty much everything related to sodium makes you thirsty. Your body just wants to drink stuff when things start going wrong. But that's basically what happens with hypovolemia, is that it just affects how easily your heart can move fluids. So the opposite of this is hypervolemia, and this is when you have too much fluid in the vasculature. And so the obvious result of that is when you've got like a big bucket of water that you have to move every time the heart beats, it gets harder and harder to move it. And so you just get general BP increases. You don't have to, the preload is fine. Nothing really changes with the preload. And so this is just constant high blood pressure. It just goes up. You also get the fact that this happens over here. This caused this, and it's kind of the reverse here. This causes edema because this really high pressure in the capillaries just kind of forces fluids out when the heart is having a hard time moving all of the fluid. It kind of just gets static, but the pressure is still high, and so it just pushes it out, and so you end up with a lot of edema. This is really significant and obvious in something like congestive heart failure, because the body just really struggles to move all of the fluid. The heart is already doing really bad, and so it's hanging on to this fluid, and it like the BP wants to drop. The body tries to compensate for it. The most common compensatory mechanism for low blood pressure is releasing ADH, which causes fluid retention, and then all of that kind of leaks out into the tissues, and that's why you see people with congestive heart failure where everything is just swollen, because all that fluid has nowhere to go. The heart can't really move it, but there's a lot of it, and so it just kind of leaks out into the tissue. So in addition to leaking out into the tissues, there's a few places where this happens a little more notably. The most concerning one that happens is that the fluid tends to leak out into, well, maybe not the most concerning, but the most concerning related specifically to volume is that the fluid has a tendency to push out of, like I said, it pushes out of the capillaries because the pressure can be so high. And one of the places that it does this with the greatest clinical effects is in the lungs. And so you start getting pulmonary edema. Which is usually goes along with crackles or something to that effect, one of the fluid related sounds. You can kind of hear that happening. And then you also get one really specific sign that is associated with having too much fluid, and that's when you get JVD. The jugular veins end up a little bit distended, and so you can see that in their neck or palpate it or something to that effect. All right. Now we're going to talk about the effects that sodium has independent of fluid volume when sodium itself starts getting high or starts getting low. Now, technically, you have things that technically it does have some effect on the membrane, but by far the most notable effect that high or low sodium has is just on the brain itself. All of the, pretty much all of the neurological symptoms, which is mostly the effects of sodium itself, are associated with the impact that it has on the brain and specifically on the size of the brain, and less so to do with activation of the membranes. So when you have hyponatty, when you have too few sodiums around, everybody's hanging out around outside the house, and there's a bunch of booze outside the house, but sodium isn't really around to be doing anything with it. So the people of the house look out there, and they're like, "Dang, there's a lot of booze out on the lawn." And we already know that the people in the house are prone to just taking things inside if nobody's laid claim to it, whether it be cats, toddlers, whatever. If it's there and nobody is standing around next to it, they'll bring it inside. So that's what happens in the brain when you have too few sodiums around to kind of guard the booze. Okay, um, too few natties, they start pulling it inside. When you pull things in, when you start pulling a bunch of fluid inside the cell, the fluid gets bigger because there's more sodium inside. It goes down the concentration gradient. You get it. The cells get bigger. Well, the skull is a very limited space. The cells can get bigger, but the skull's not going to get any bigger. And so the brain starts swelling up, and you start getting edema inside the brain. This causes pretty negative effects. It starts compressing a lot of tissues. You can start seeing damage related to this, but generally speaking, you're just going to get cerebral edema. Which is associated with pretty much just neurological symptoms. Honestly, I don't think that you need to know specifically what they are. I think you just kind of need to know that these changes in sodium cause cerebral edema, and it comes with neurological symptoms, altered mental state, confusion, lethargy, etc. The having too much sodium around causes its own issues, though, because now you got a whole bunch of sodium out in the yard, and they're all going wild out there, and the homeowners are like, "Dang, we have all this booze in here, but sodium out there, he's going to go crazy if he doesn't have enough booze." So they start chucking fluids out of the cell. They start giving all the fluids off to sodium, and sodium is like, "Heck yeah, I know what to do with this." And so all of the tissue in the brain, really all of the tissue, but specifically the greatest effect is in the brain starts shrinking, which if it just shrinks a little bit, that's really not that big of an issue. Most of the time, you won't see serious issues with hypernatremia until it starts getting a little bit out of control. But at some point, you have all these little veins that connect the meninges to the brain and provide blood to the brain. And at some point, those can only stretch so far. If the brain shrinks enough and the skull can't shrink with it, these things break. And all that blood starts rushing out into this cavity instead. And so that's how you start getting hemorrhage. And specifically, you'll see this called subdural or subarachnoid hemorrhage. And so the effects of this are also going to be primarily neurological. You're just going to see some brain changes, altered mental state, etc. Both of these are medical emergencies, very serious. And so if either of these things start happening when sodium goes way too high or way too low, these have to be rectified immediately. Most of these issues are going to be solved using IV fluids. You can use diuretics to reduce volume related issues because those are typically a little less emergent, but especially here in the brain issues, these have to be resolved using either high or low osmolality fluids. So if you have too little sodium, what's the obvious choice for fixing that? Well, you're going to administer high sodium fluids, 3%, 6%, something to that effect, salines. When you start giving those fluids, the effects of the low sodium levels will be reversed because there's enough sodium in the fluids now, and all the homeowners start doing what happened over here, and they start chucking all the booze outside for sodium to party on. And so the brain will go back to normal size and everything will be fine. And then over here, the problem is usually that there's too much sodium outside. And so there's too much sodium outside and there's not enough booze to keep sodium happy. So you start giving low saline because you don't want to add people to the party, right? So you don't want to add more saline to the mix, but you do need to add more booze so that the booze to saline ratio is correct. So you start giving hypoosmolar fluids like um, a dextrose solution, D5W, or half normal saline, or something to that effect, something that doesn't really have any saline to it, and all it's going to do is provide some fluids for the party. As far as the bulimia issues go, bulimia is just going to be solved by giving fluids. If it's that's somewhat dependent on which one of these happens, but typically they can just be rectified with normal saline or half normal saline, depending on like which situation that you're in. They can you can solve hypervolemia issues typically by using diuretics, and it will cause the body to chuck fluids out, and it will also cause the body to chuck sodium out. So if that's related to the issue, that can be helpful as well. Um, so the solution to most of these things is pretty much just going to be the correct fluid. If you give the wrong fluid, it will exacerbate these issues and do serious harm. If you give the correct fluid, it's really simple. It basically just hooks sodium up with the correct amount of cores, which is the wrong brand. I probably should have gone with Nanny, but it is what it is. Um, and everything, he just parties on as usual, and everything